Let's break down the essential data regarding baseline stroke risk in young women. As physicians in training, understanding the precise baseline epidemiology of cerebrovascular disease is critical before we can accurately evaluate secondary risk factors, variables, and population metrics. The data plots the ischemic stroke cumulative incidence per 100,000 on the vertical axis against 5-year age groups on the horizontal axis. This specifically tracks a cohort of women of reproductive age, from 15 to 49 years old. Each plotted point represents the average yearly cumulative incidence for that age bracket, bounded by vertical confidence interval error bars. The exponential trajectory of aging. The most vital clinical takeaway from the data structure is that risk acceleration is non-linear. It follows an exponential curve. Ischemic stroke is exceptionally rare in the youngest cohort, with an incidence of just 1.4 per 100,000 among 15 to 19-year-olds. However, look at the final data point. By ages 45 to 49, the incidence climbs to 30.2 per 100,000. This represents a massive, greater than 20-fold spike in background vascular vulnerability driven purely by chronological aging. The 35-year inflection point. Pay close attention to the sharp transition between the 30 to 34 cohort, 7.8 per 100,000, and the 35 to 39 cohort, 12.5 per 100,000. This noticeable jump represents the precise clinical inflection point where baseline stroke risk begins its steep upward climb. This specific epidemiological data justifies why international clinical guidelines treat age 35 as a strict physiological threshold when evaluating a patient's vascular safety profile. Clinical context: migraines and exogenous estrogens. This baseline dataset serves as the foundation for evaluating the risk of prescribing combined hormonal contraceptives, CHCs, to women with migraines. Migraine, particularly migraine with aura, presents an independent stroke risk due to endothelial dysfunction and altered cortical perfusion. When you introduce synthetic estrogens, which promote a prothrombotic state via hepatic clotting factor upregulation, you add a secondary insult to a vulnerable vascular bed. Definitive actionable practice. Because the baseline stroke incidence multiplies so aggressively past the mid-30s, the relative risk multiplier of combining migraines with CHCs translates into a dangerous absolute risk of an acute ischemic event. Therefore, combined hormonal contraceptives are absolutely contraindicated in any woman over the age of 35 who suffers from migraines with aura. For these patients, you must aggressively manage traditional cardiovascular risks and pivot to non-estrogen options, such as progesterone-only choices or non-hormonal copper IUDs.